Welcome to the session Partnering to Close the Health Equity Gap Lessons Learned from the Frontlines. To combat the growing health inequities exposed by COVID, the healthcare industry has stepped up to form substantive cross sector partnerships in new, innovative ways. Throughout this panel discussion, experts will highlight the challenges, successes, and key learnings obtained throughout the journey, providing critical insights for organizations to develop partnerships to close the health equity gap. This session is sponsored by Quest Diagnostics. As the world's leading provider of diagnostic information, Quest's employees work every day to uncover insights that empower better health. The moderator of this session is Mandel Jackson, Vice President and General Manager of Quest for Health Equity at Quest Diagnostics. Mandel, the floor is yours.
Hello, and thank you, Maria. And I hope you all enjoyed the keynote address. As Maria said, my name is Mandel Jackson. I'm the Vice President and General Manager of Quest for Health Equity. Before we get started, I'd first like to welcome our panelists, and I'm going to introduce them to you. First, we have Monique Wilson. Monique is the National Corporate Relations Director at the American Heart Association, a 97-year-old organization whose mission is to be a relentless force for a world of longer, healthier lives. Monique, welcome. Also, my friend, Dr. Gloria Del Amador Fernandez. Gloria is the president and CEO of what I will call SIM. I will ask her to really sound that name out for you, but I will attempt. It is Salud Integral en la Montaña, but we refer to it as SIM. SIM is a federally qualified health center in Puerto Rico that provides primary and preventative health care services to medically underserved communities since 1974. And last, my friend, Ms. Diane Sanchez. Diane is the chairman of the board at the Social and Health Research Center, a nonprofit organization founded in 1991 with the mission to reduce obesity in at-risk populations and address associated chronic conditions such as diabetes and cardiovascular care. So welcome to my panelists, but also I'm going to just jump right in. First thing is welcome to you all. Thanks for joining us. We've all witnessed COVID-19 reveal and even exacerbate healthcare disparities impacting vulnerable communities. In 2020, feeling a need to better assist in closing the healthcare gap, my organization, Quest Diagnostics, launched a $100 million+ program called Quest for Health Equity. The goal of Quest for Health Equity is to directly address the health inequities impacting those vulnerable communities across the United States. The disparities that we're going to speak about today are due in large part to the social determinants of health, which include education, access to healthy foods, and quality health care. As a result of the pandemic, life expectancy for Blacks and Hispanics across these communities has decreased 3 to 4 times that of whites. Sadly, a person's zip code has greater impact on their health outcomes than their genetic code. Also, when we talk about costs, the cost of healthcare disparities on our communities has been extreme. There's a staggering $93 billion in excess medical costs. It also has resulted in greater than $42 billion in lost productivity. Today, we're going to talk about all of this. And the reason we're being joined by this panel of guests is they have each dug into this intimately. They have programs, initiatives, and approaches that we're going to all learn about and we'll learn from. One of the things that Quest Diagnostics realized early on in our venture in Quest for Health Equity is it takes a village and you absolutely have to have the right partners. So we're going to jump in and we're going to get started with our panelists. I'm going to jump into the first question. And this is a question that we're going to ask everyone. Can you please tell us a bit about your organization, the approaches that you are taking to address health inequities, and some of the things that you've learned about your programs thus far? I'll start with Dr. Amador.
Hi, everybody from Puerto Rico. Let me talk you a little bit about our organization. Salud Integral en la Montaña is a community non-for-profit organization. We were founded in 1974, and we are certified as Federal Qualified Health Center, as Mandel just said. and also recognized as by the National NCQA as a patient-centered medical home. SIMS provide preventive, primary, and specialized health services to the populations located in 7 municipalities in Puerto Rico through our 9 community health centers and 4 24/7 emergency rooms that we have that is a door to enter our services. We do also have special programs like home care, hospice, outreach and enrollment activities. We do have healthy families and as well as HIV/AIDS services, specialized services for our community. Recently, SIMS established the first post-COVID care clinic in Puerto Rico, where we are servicing long haulers. At this point, we already have 424 patients that are being taken care of in our clinic. Related to health disparities in Puerto Rico and the major gaps that we're seeing that SIM is addressing, I may say that the disparity in funding to Puerto Rico is one of the major gaps due to the discrepancies in the FMAP that we receive. Puerto Rico received a 55% FMAP, but Puerto Rico is entitled by poverty levels for a 83% FMAP. Nevertheless, in the last years, due to emergencies like hurricanes Irma and Maria, earthquakes, the pandemic, we have been receiving additional funding to cover and guarantee services to over 1.6 million U.S. citizens that resides in Puerto Rico as a territory. Recently, I would like to say that the House of Representatives just approved an increase in the FMAP for Puerto Rico, includes the benefits of Children Tax Fund and also the SSI, but is now under review at the Senate. So we expect those future fundings. And finally, the unequal treatment that the territory receives impose enormous economic burden to an island who was already in bankruptcy with a $72 billion debt. So there's great concerns about how essential health services could be affected and how providers like SIM has to constantly search for donors to sustain our operations.
Hey, Gloria, thank you for sharing. And what you're doing on the island with SIM is amazing. That coordinated care is something that I'm sure others are excited to hear about and will learn about. I'm going to go to Monique at American Heart Association. Monique, could you tackle that first question for us also?
Sure, and thank you so much for having me. So as you mentioned, the mission of the American Heart Association is to be a relentless force for a world of healthier, longer lives. And while the American Heart Association has had a long time history of really addressing access and health equity, the turmoil and the trauma that brought about or really heightened awareness around inequities in 2020 have really prompted a deeper commitment from our organization to really look at innovational approaches to removing barriers to health equity, firstly through science, but also community investments and improvement to healthcare access and quality, and lastly, policy change. Specifically, we're looking at barriers and ultimately the drivers of health disparities, such as social determinants of health, where people live, work, and play, but also structural racism, because we know that there are systems in place, public policy, institutional practices, cultural, that really impact racial inequality. And then lastly, really looking at rural health and the geographic and resource challenges that are leading to gaps in health and healthcare overall. We really know that achieving health equity requires valuing everyone equally. And so constantly looking at those ongoing societal efforts to address avoidable inequities, really looking at both historical and contemporary injustices are really what's going to be needed in order to eliminate health disparities overall.
Thanks, Monique. And we're going to come back and talk about one of the programs that I know you're intimately involved with. But next, we're going to go to Diane Sanchez. Diane, again, same question for social and Health Research Center. All yours.
Thank you, Mandel. First, I want to commend Quest and Modern Healthcare for the commitment to combat growing health inequities. I think just hearing the other panelists, it's obvious that these are things that are really prevalent in our community. And I think that talk a little bit about the Social and Health Research Center. Since 1991, and Mandel mentioned this, we've been in operation, but we're committed to the populations at risk. And we've operated and worked in San Antonio and South Texas to develop health programs and to prevent obesity and the associated chronic diseases. But one thing we realized early on was that what we needed to do was try to get ahead of the curve. And we found that in our research, many of the students or the children in San Antonio were of low-income families, working hard to stay healthy and also to try to overcome some of the barriers that they have to face every day. But because of the growing needs of the community, Dr. Roberto Trevino, which was our founder, a researcher and a physician, recognized that his patients had advanced chronic illnesses, which were attributed to their diets and lack of exercise. So he left his practice, and we started a program called basically operating Bienestar NEMA, which is a coordinated healthcare program. It's in English and Spanish. It's both for the pre-K through the 8th grade students, and it also is adopted by the Texas Educational Agency, which is TEA, which is one of the three official state healthcare programs in Texas. One thing we're really proud of as well is it's an evidence-based program that's been recognized and been awarded several research grants by organizations like NIH, the USDA, and DHHS. But what's really important as well is it's recognized by the National Cancer Association Institute and the Quality and Center for Disease and Control. But one of the things I think you asked about, Mandel, was the health disparities and what is it that we're looking at. Our communities, the communities that we serve, represent low income, undereducated, uninsured, underinsured, and many of them at times experience food insecurities. But I am extremely concerned about the state of health disparities in Texas and most of the states in the country. We've expanded our program thanks to Quest nationally, but we recognize now that most of the states that we have engaged with have a big challenge to commit necessary resources to the health and physical education programs in their schools. But the one thing that we've seen consistently that's the underlying condition that we saw in COVID, it continues, is obesity. And I'll just talk a little bit about that based on why we're focused where we are. But if you're not aware of it, the African Americans, Hispanics, and the non-Hispanic whites were disproportionately diagnosed with COVID. But the prevalence of obesity, relatively speaking, is 50, 45, and 42%. The levels of obesity for these three groups makes America the most obese country in the world. And Texas, as an example, has 1 out of every 3 residents is obese. But bringing it back to children and what we're trying to focus on is the obesity rates among the ethnic and racial populations in San Antonio is disproportionately high. For example, Bexar County, which is our statistical metropolitan area, 27% of the Blacks and the Hispanics are obese of children, while only 12% of the white children are obese. So there is disparity there. It's not surprising that 1 out of every 5 children in San Antonio is uninsured and below the poverty line. We also focus, and we'll talk a little bit about the Texas-Mexico border, where it even gets a little bit more difficult with the children in the sense that 38% of our residents are uninsured and living in poverty. There's about 34%. But our focus right now to address some of these gaps is in 2 areas: the early intervention of what we call health education and wellness literacy. We'll talk a little bit about that, Mandel, later, just to give you a focus of what we've taken based on the research that we've done.
Yes, sounds good. Thank you, Diane. And I tell you, there are so many powerful things that you just mentioned with the Bienestar program. And I think one of the lessons that Quest Diagnostics learned through our involvement with your organization is the impact on healthy behaviors that you get through kids. So you guys recognize the need of the health gap to be addressed in that community, but you also see the power in leveraging the kids for healthy behaviors. And that's a lesson for us to learn. I'm going to shift a bit. And again, we're going to start at the top. With such large gaps in health equity, what is the role of partnerships in closing this gap? And what 1 to 2 key innovative approaches are you taking that are having the most impact? And we'll keep the same order. I'll go back to my friend, Dr. Gloria.
So for SIM, partnerships to address health equities and key innovative approaches are very essential to move forward. Efforts are required to work through the government within all the sectors in the island so we can take an holistic action on social determinants requiring considering all the interests and including people from all the groups in the decision-making process, especially those groups who have been in the disadvantaged groups. SIMS already participates in a variety of groups that intends to encourage participation within the society so we can help improve the management, the vigilance, the responsibility, transparency, and evaluation of health outcomes and data. Without data, we cannot put new things go through. The health sector needs to exercise more their leaderships in creating strategic alliances with other sectors that already have been working with social determinant of health and that also are in different aspects like environment, education, employment, so we can encourage debates and guide the formulation of new policies on social determinant of health. Partnerships that SIMS have, like the one with Quest Health for Equity, allows the establishment of new services to help close those gaps on services to patients who will be affected with the sequels of the virus. So for us, it's very important to have this kind of partnership that allowed us the opportunity to impact the life of many people. I just want to close saying that SIMS have been in the forefront presenting initiatives that help the public health of our communities, not only related to health, but also in social aspects, looking for a better lifestyles in our communities. COVID survivals requires multidisciplinary services that can adapt to the consequences that the sequels will bring to them. So that's one thing that we will be helping the scientific community to gather the data so they can keep studying how we can impact the life of these patients and have them get through the consequence of the virus.
Thank you very much. Hey, Monique, at American Heart Association, what's the role of partnerships with your organization, and share a couple of approaches that you all are taking?
Sure. In my role as National Health Equity Lead for our National Corporate Relations team, central to my work is really the establishment of public-private partnerships. And those really have been found to be really effective strategies in closing the gap, but also very vital to our work in communities. Additionally, at the community level, establishment of community to clinical linkages, especially when we talk about the need for addressing social determinants of health and wraparound services that are truly needed to impact health and move the needle. My personal mantra is nothing for community without the community. And we often know that solutions to addressing inequities are in and of themselves in the community. However, there is great need for capacity building and resourcing for community-based organizations. And so we've spent over the several years really investing in communities directly to impact everything from helping families to avoid eviction rates to diverting pounds of food to individuals that otherwise would not have it. But truly, the solution is community investment. And then I even think about the importance of representation across the healthcare spectrum. We are very proud by our collaboration with Quest to not only expand our historically Black colleges and university scholars program, but really looking at standing up the Hispanic Serving Institution Scholars Program. Again, because we know that representation matters, and it's important to make sure that we are providing resourcing appropriately to students that want to go into careers that ultimately will impact how we see the direction of health inequities turn.
Thank you, Monique. And we're going to come back to that program that you referenced that has the 3 pillars, the FQHCs, of course, but specifically the HSI and HBCU Scholars Program. Hey, I'm going to finish this question with Diane. Diane, tell us about the approaches that you all are taking and how partnerships are playing into SARC.
Sure. This is an area that I'm really excited about. I think in a way, the pandemic was a blessing for us in the sense of us being able to reach a lot of the students, a lot of the children and the families that we were looking at. And I say that because it forced us into a technology that is now more advanced. A lot of what we did was manual, and it also was more accepting based on the conditions that we served. And then also, I think what's really exciting for us, and I'll talk a little bit about both of them, was the relationship with Quest. I'm totally sort of negative on when it comes to philanthropy in the following. I think it has to be a collaboration and a win-win based on from a business perspective and a relationship perspective. And I think that's what Quest brought us and has sort of set the stage for what we're going to do with other partners. But let me talk a little bit about the focus on the technology and what's happened to our program. And I think a lot of our focus was building the foundation. What we find is the first 12 years of the child's life builds foundation for future health and wellness and success. So without a doubt, we reinforced what we were doing. But what was really exciting now because of the technology is we focused on education and what we call it is edutainment. And edutainment, which is retention and engagement. So what we're able to do now is not only educate the students, but entertain them and engage them and their families on what we're doing with a 3D application curriculum that we've presented, which is really just an interactive application, an ed tech program, which allows the kids to actually view digitally animated lesson plans, testing instruments, and even introduces gamification techniques. And the other thing that always excites us is all of this drives our ability to manage data and actually, again, reinforce the evidence-based approach that we have. So that's the technology side of what we've done in evolving our program and adopting it. And we're seeing such success right now with the teachers, the staffs, the parents, and the children. But the other piece that I'm going to sort of stress is I think you mentioned it earlier, Maria, was the private public sector initiative, which Quest brings to the table. And I think that with Quest Diagnostics, what I mentioned earlier, and I looked at some of the alignment with them, I'm just accessing testing, which is early childhood testing, which I don't think is normal in a lot of the environments we work with, but also focused healthcare services. That's so important with what we're trying to accomplish. And then the actions to improve long-term well-being, which is where Quest is coming. But take that a step further. It's forced us to really think through who are the other members of this collaborative based on the ecosystem that we're trying to create. We have a research partner with the University of Texas. We're focused now on food and beverage sector, insurance sectors, and then the private and public education system from pre-K to 8th grade. But what's really important as well is the local, state, and federal government. And the reason that's important, which is what I've seen, we've had bills passed, but the programs and the policies that are introduced are so important because they have to align with what we're doing. And I think those are the things right now that are exciting. As I mentioned, it's the technology as well as the collaborative ecosystem with the private and public sector that we're working on. Thanks to Quest.
Yeah, thank you, Diane. Another great answer. We're going to shift from partnerships and we're going to dig into a couple of these initiatives a little closer. I'm going to Monique. Monique, it is difficult for any organization to wrestle hypertension in any of these communities. but you and the American Heart Association have an initiative that's focused on hypertensive relief in the Black community. Can you give us a sense of how you will know when you've made progress? What does good look like for an initiative like this?
Well, it's a very ambitious goal that we have set in working in partnership with federally qualified health centers across the country, including those in Puerto Rico. We are really looking at how can we support clinics in improving their control rates to at least 80%. And what that looks like is that basically 4 out of 5 patients that are diagnosed with hypertension have those numbers at control. For numerous years, you've probably heard a big vocal campaign voice for the American Heart Association was looking at knowing your numbers and do people know their numbers and how important it is to know your numbers. And what we found over the years, as we hit that benchmark, is that it wasn't as much so that people didn't know their numbers, it's that they were struggling to control those numbers. And so because of that, we quickly pivoted to working with community centers and FQHCs specifically to support them in their work. So what are those gaps that are hindering people from getting to control? We know that 1 in 2 individuals are not at control. What are those things that they're lacking to get there? And we know some of that is medication compliance. Usually that's due to some type of impact or feeling that it has for the patient that they're not liking. And so helping patients to better communicate with their providers in regards to how medications might be making them feel. So it's more of a team approach to that clinical care, and they really feel like they're a valued part of that clinical team has been very important. And then also making sure that patients have blood pressure monitors at home. That is truly important. Oftentimes, patients may not have their blood pressure checked, but when they go to the doctor's office, it's really important for individuals to understand, especially if their blood pressure is uncontrolled, how their daily lifestyle behaviors impact their blood pressure. So having access to those machines really help them to understand those nuances.
Thank you very much. That's one that we are excited about. The ability of the AHA to do some of the things that we were trying to do is the reason that we stepped into this with you all. And again, it takes a village, and you all are part of the village. Speaking of village, we're going to go back to Texas with Diane. Diane, on this one, again, this is going to be a follow-up question on a tougher issue. A lot of the things that we are funding and we are interested in are the behavioral focused initiatives, and that's really hard to measure. The SARC program, the Vienna Star program that you mentioned earlier, is looking at what you can do to drive healthy behaviors and change through kids. For that initiative, can you speak to us about what you're measuring? What are the metrics? How do you know that a program like that is working?
Sure, a lot like Marie, what you're doing with the Heart Association, it's know your numbers, data. And I think a lot of that is what we're doing, which is we're the only program, believe it or not, that's evidence-based to the extent that we literally can prove that we are making an impact. But I think what this is, all this is going, Mandel, is the blueprint that we're trying to create right now with the children and making sure that we're doing the right things and the money and the resources are invested. Things as simple as if you look at some of the studies that are being conducted right now, increased fruit and vegetables and decreased dietary fat intake. Yeah. But what we find even in the public schools is these kids are probably provided maybe, I'd say 75% of the fruit and vegetables they're supposed to, but they only consume 20%. They consume 20% of what they're served. So a lot of that is back to the parents, the families, learning how to eat and knowing the importance of that. The other is the increased fitness levels, which the testing that we do with these kids to see what the improvements are from when they start the program within certain metrics that we established. And of course, decrease obesity, anything from weight circumference to body mass indexes. Those are the things that we're looking at. And then, of course, we try to monitor the decrease of blood glucose and the serum insulin levels. It's sad, but we've had kids that are now 7 to 9 years old that are having signs of type 2 diabetes. So these are the things that we're really working with. And then the other thing is we increase the healthier food options with the cafeterias. We're really working closely to monitor that, not only that they're serving them, that the kids are eating them, and then helping the parents and the families. But those are the things that we're measuring. And then we do impact adults as well. And so the adults that are in our program that are overweight, we try to measure at least what we call 0.104 kilograms per weight per session loss at every training session they have. So our program is evidence-based. And again, we're trying to demonstrate tangible results through data and metrics that we're establishing, and collaborating a lot with Quest and how it is that we can work and measure these results together.
Okay, thank you, Diane. And I'm glad you added that last part about the adults, because I know that you have the family members, the parents, as well as the teachers all involved in that program. Hey, I'm gonna call an audible, and I think you all will be okay with this. A lot has happened since COVID, and there are a number of programs outside of the ones that we just talked about that you're focused on. And we have a number of people listening in and watching who are thinking through things that they may tackle to try to rid us of these healthcare inequities. What's the biggest lesson that you have learned over the last 24 months in your mission to address health inequities in your areas? And whoever wants to go first, what's the largest, the biggest lesson you've learned?
I'll start. I think I hinted to this earlier, but the importance of community-led strategies, I will say, continues to ring loud. The community is the solution. It's not that we as partners are bringing those solutions to the community, but we're helping to support, to elevate really their voices and their capacity to be able to solve for those challenges. Really leveraging and supporting what we reference them as anchor institutions in communities is really important to transforming change. Their voices are the trusted voices. And so we should lead with those. And so when we help to train and equip individuals, they often are the best messengers. And so that truly has been something that I think that we all can learn from and really supporting.
If you want to continue, in our case, the more important lesson we learn is that even in difficult times, we have been there for our community. When the pandemic started, or when we started to hear about what was going on in China, we started preparing our staff, our providers, on the protocols that were available on that time for the impact in Puerto Rico if that happens. The government was thinking that that wasn't going to come to Puerto Rico, but they start late on the process of getting prepared. We received the first executive order to shut down. Puerto Rico was closed all over. Only the health centers or the health providers are the one on the streets providing the services. Now we have seen the value of our employees. They have been exposing them to serve the community. The engagement they have to serve passionate to for our patients allows us not to shut down our operations. Even we have 24 hours emergency rooms. We kept them open for the community. And also having to establish immediate action to attend things we don't know, implementing the testing sites, implementing the vaccination programs was very important for us to have previously planned for emergencies that we can customize for this kind of public health emergency we're just passing through.
Thank you, Gloria. Hey, Diane, can you share last for us?
Yeah, I think, my thing there that comes to mind is I think understanding the barriers in a community, truly understanding the barriers. And it goes back to don't give people fish, teach them how to fish. Putting in perspective, what is it that's keeping people, or basically driving obesity, that's driving some of the health issues we're struggling with, and literally what are health options? Because we see that people are given, they're given food, but they're not the right food. They're not really taught the whole, what I mentioned earlier, wellness literacy. And I think that's really been enlightening to me, is that people mean well and they're doing a lot of things, but we're not doing things in coordinated fashion with data and really things that make sense to help people learn how to eat better, how to really care for themselves, and giving them a baseline to work with. The other thing that my background's tech, so I can speak to this, is digital natives need digital content. And what I am so impressed with is that the impact that we've been able to make with the kids, literally through these animated interactive programs, has been phenomenal. And then the parents get excited about it as well. And I think that's been really great. So hopefully if we can keep through the edutainment, basically programs, I think that's going to be exciting. And it gives us an opportunity to actually measure the impact as well. So those are the two things that I've learned, I think, in the last probably year.
Thank you, Diane. And I'm glad we asked that question, because with that audible, I captured a few things that I think we should remember. Number one, barriers, really understanding the barriers in the community. I think each of you talked about listening, which is really slowing down and not forcing solutions in where they don't fit, but really listen and understand what the needs of the community are. Two of you mentioned partnerships, not just in your answer of my question, but you talked about how critically important it is to establish partnerships with the right people, not just the for-profit companies, but the influences in the communities. That really matters. And then the last, I think, Diane, what you said, and Monique, you mentioned also, it's aligning the answers to the needs. Again, not trying to fit square pegs into round holes. I want to thank you all for the time you set aside to join me on this discussion today. We talked about a lot. I think we learned a lot. I think what you shared about establishing partnerships really makes a difference for those who joined us today. But again, I hope you would agree, while we've talked about a lot, we've accomplished a lot together, we're still at stage one of a multi-stage race. The issues that we have taken generations to present. Is going to take more than effective partnerships here today to answer and solve for them. But again, if you are one hoping to step up to the plate like my guest here today, feel free to reach out to us through questforhealthequity.com or shoot us an email. It'd be much appreciated. And again, my panelists, thank you all for joining us today. And that will conclude our discussion.
Thank you to our speakers for that discussion. We'd like to once again thank the sponsor of this session, Quest Diagnostics. For more information about Quest for Health Equity, visit questforhealthequity.com.